What the heck is that? Oh. Oh, good morning.
You woke up.
Yeah. He wants to go outside. Boop. You're such a good boy. Oh, yes. Cuteness, get him. Yeah. He has hind limb weakness, which has been kind of recurring for the past couple of years. He does have a history of being started on an anti-inflammatory medication, but we're trying to see on his exam. Dr. Joseph found that he does have some slow reflexes in the back legs. He doesn't replace his paw. Which indicates a problem with his proprioception. He's doing an orthotic exam to look for any evidence of like optic disease. You can see things like retinal hemorrhage if they have, for example, like high blood pressure, or if they have a bleeding disorder. You can see if they have fungal disease. You can see like fungal hyphae in the back of the eye. You can see Dr. Joseph's baby Dr. Joseph. Because he is doing pretty well and walking pretty comfortably, you can see he's really strong here. His big problem is really he just kind of knuckles sometimes in the back and doesn't walk normally. We suggested to the owner to continue tapering him off of his anti-inflammatory and seeing if he continues to do well. With that, we're going to want him to continue to rest really strictly, and if when we taper him off his anti-inflammatory he's not walking or he's weaker or seems painful, then the recommendation would be for him to come back in and potentially get an MRI to evaluate for potential disc disease. And generally, if they fail medical management, which is rest, anti-inflammatories, and pain meds, surgery is recommended depending on how compressive a disc might be.
This guy has gallbladder mucocele, which is basically where all the bile congeals and gets really thick and irritates the gallbladder wall, but it was found incidentally. So if they rupture, they can be really bad. So we put them on medications. We wanted to see if they helped decrease the thickness and all the sludge that was in the gallbladder, because we're trying to avoid him having surgery. So I just have to repeat it and compare it to the previous ultrasound we did about 2 months ago. Back.
Hi, buddy. You got food?
Actually, I know what it looked like today. I can look at this old one. Yeah, it may be slightly better. It's still full of the really thick bile, but seems maybe the wall of the gallbladder is a little bit better. So I think it's reasonable just to continue the medications. But if the owner's really nervous, since it hasn't changed dramatically, there's no absolute reason not to take it out. There's just more risk with surgery, being under anesthesia and everything. So we'll have to see what they want to do. I think we got two options.